Hello everybody, welcome to my YouTube channel, Homoeopathy Super Sessions by Dr. Jarvis. Today I'll be taking the next part, that is a part 4 of J.H. Allen, Volume 2, Psychosis, Suppression Induced by Operative Methods. So let us see what this small video will tell you about the different forms of suppression and what is the relationship of psychosis to suppression. Modern surgery is another great source of suppression of the disease, which gives rise to secondary and tertiary lesions. So the main cause is the modern surgery. If surgery is done, then definitely the disease will be suppressed according to Dr. J.H. Allen, and it will give rise to the secondary and the tertiary lesions of psychosis. A great proportion of this class of surgically or mechanically treated disease, now so common, is dependent upon psychosis. So if the disease has been removed surgically or has been treated mechanically and suppression takes place, so Dr. J.H. Allen says that the psychosis will be suppressed, or the psychosis or whatever suppression is there, the psychosis will be dependent upon the suppression. The specialists drive a large income from what the suffering public without really knowing what they are treating. So Dr. J.H. Allen says that the different specialists are there and they earn a large amount of money from the public who is suffering without really knowing what they are treating. So the specialists basically, they treat the disease, but from the homeopathic angle or from the homeopathic point of view, they do not know actually what they are treating. Let us see further what we mean by that. It is not so in the case of syphilis. So he tells you that in the case of syphilis, it is not so. They are extremely careful and cautious how they approach or operate upon syphilitic lesions. So the specialists out there, it is not the case as it is not so in the case of syphilis. So in the case of psychosis, the specialists will cause suppression. But in the case of syphilis, it is not so. Why? Because they have been very cautious and to the approach towards the case of syphilis. This is because they have learned the lesson well with their past experiences. So their past experiences has told them that if you suppress the syphilitic lesions or if you do suppression, then it will have a disastrous effect. The past records of such procedures have proven to them over and over again that the results are disastrous. So whatever procedures they have done, and if they retrospectively see the cases what they have treated, the past records will show them that the result was disastrous. The disease returns or retaliate against them in some other part of the organism. So what happens? The disease will return or it will retaliate in some other part of the organ. They have found out that the so-called antisyphilitic or constitutional treatment is safer and far more satisfactory in the end. So they have come to a conclusion that either by giving the proper constitutional treatment or the so-called antisyphilitic treatment, it is much more safer. Then why should we not have the same thing be true for psychosis? So psychosis in some way is more destructive, speedily brings the death process. So in compared to syphilis, the psychotic process is more destructive and it will speedily bring the death process. Syphilis will often take years to accomplish what psychosis has just begun. So the syphilis will gradually have a slow onset and it will take years to accomplish what psychosis has just begun. So in psychosis, the onset, according to J.H. Allen, is quite fast. Psychosis will bring to a fatal conclusion in a few months or in a few weeks. So the death will take place in a few months or in a few weeks. That is the virulence or that is the pace of the psychotic miasm. This is because men fail to see the true relationship between the act of suppression and the new disease and the new process that are forthcoming. So they said that men will fail to see whatever the true relationship is there of the disease and that of suppression. So when the disease gets suppressed, there will be a new disease or some other organ in the body will be affected and a new process will be started. Furthermore, they are not familiar with the working of the sycotic miasm. So besides this, actually they are not familiar about how the sycotic miasm works. They scarcely know anything about the secondary or tertiary symptoms that are developed after it has been suppressed. So they don't have enough knowledge that what will happen to a case when it has been suppressed, especially a case of psychosis, and they cannot identify that the secondary or the tertiary symptoms are there because of suppression. This is true for the schools of medicine who have not studied the miasm. So this is a reference to the specialists or the allopathic method or the antipathic method of treatment, wherein they have not studied the miasms. Pneumonia may suddenly develop and take away the life of the patient, yet it appears to be no different to them from the ordinary form of that disease. So when a disease has been suppressed or when the sycotic miasm has been suppressed, pneumonia may develop. And they think, the specialists think of the old school, that it is an ordinary form of the disease. They do not know it is a form of suppression because the disease has been suppressed and it goes into the more important organs like the lungs. Similarly, peritonitis may make its appearance in women after a suppression of leukorrhea or after an operation upon some of the pelvic organs that were affected with psychosis. So, same thing for peritonitis. Suppression of leukorrhea will give rise to peritonitis, or operation of some pelvic organ which was affected by psychosis also will cause suppression. The relationship between the secondary inflammatory process and the suppression of a specific venereal leukorrhea is not seen. So what they fail to recognize, or what they fail to see, the relationship between the secondary inflammatory process and the suppression of a specific venereal leukorrhea is not seen. Neither could they see why one case of peritonitis is speedily cured and another runs to a pus pocket, extensive adhesions, and perhaps perforation. So they could not even realize that, or they could not even fathom that why some cases of peritonitis were cured speedily, whereas other cases they have deteriorated and there were pus pockets, there were extensive adhesions, and even perforation, claiming the life of the patient. We must become acquainted with the psychotic lesion. So Dr. J.H. Allen says that we should be acquainted with the psychotic lesions. That is what? The psychotic pus, the psychotic inflammations in general, before we can recognize the two processes as they develop from one condition to the other. So you have to have the knowledge of the psychotic miasm and about the characteristics of the psychotic miasm with respect to the psychotic pus or the psychotic inflammation. Thus, we must know the true character of the psychotic poison and all its processes, especially where it is suppressed, and the effects of the virus upon the system. So you have to know the character of the psychotic poison or the psychotic miasm, especially when it has been suppressed, and what effects suppression has upon the system. In closing up of a sinus that is freely discharging purulent matter, such as a fistula or a burrowing abscess, will often develop into some severe stasis of the original disease. So if a sinus is there, or if a fistula is there, or if an abscess is there, if you close it up, then they will develop, some stasis will develop elsewhere in the original disease. That means what? Again, you will be causing suppression. I have seen psychosis which has been latent for years, stirred up by repair of the lacerated cervix, lessening the drainage of the uterus. So Dr. J.H. Allen says that, I have seen psychosis which has been latent for years. So psychosis was latent for a number of years, but moment the patient was operated for a lacerated cervix, the psychosis blew up and it caused the damage to the uterus. So the latent stage was activated and the patient deteriorate. He further says, I have seen ovaries or tubes often become involved after a curatement. So after a curatement, the ovaries or the tubes are also involved. The uterus becomes enlarged and a chronic hypertrophy follows curatement. So what happens? The uterus will become enlarged and there will be hypertrophy following the curatement. Abortions, childbirths, and their after effects will frequently stir up an old latent psychotic difficulty that is very hard to eradicate. So by doing abortions or during the process of childbirth, it may be so that the old latent psychotic miasm may get activated and again becomes very hard to eradicate. Operation on the rectum, removal of the hemorrhoids also causes suppression. Suppression of hemorrhoids by medicated suppositories, rectal injections are all modes of suppression and should not be employed. Many cases of hemorrhoids, proctitis, and other disease conditions in the rectum excuse me, are due to the gonorrheal stasis. So, anything to do with hemorrhoids, proctitis, and other conditions of the rectum, they are because of the gonorrheal stasis. A slight oozing from the rectum of a fishy odor is not uncommon in hemorrhoids due to psychosis. So, in psychosis, you will get a typical fish brine odor or fishy odor, which is not uncommon in hemorrhoids due to psychosis. So, if hemorrhoids are due to psychosis, then you get a oozing from the rectum with this characteristic fishy odor. A slight oozing from the rectum of a fishy odor is not uncommon in hemorrhoids due to psychosis. Warty and warty growths are common, although what is known as condylomata never come from sora or psychosis alone. So, whatever warty growths are there or other growths are there, they never come from sora or psychosis alone. A careful investigation of cases will relieve both the miasm, syphilis, and psychosis to be present. So, two miasms will be present if there are warty or wart-like growths on the body or on the individual. It is not only because of the psychotic miasm, but it is because of a combination of both psychotic and syphilitic. This is the view of Dr. J.H. Allen. Thus, we get formation of condylomata, pointed papillary growths, warts, etc. The removal of any of these psychotic expressions by local measures such as potash, strong acids, by actual cautery or electrolysis is a fruitful source of suppression of the disease, of which may arise many of our worst forms of malignancy. So, whatever the psychotic expressions are there, and if they are removed locally by the means of all these other medicines, then it will cause suppression and it will give rise to the worst form of malignancies. Thus, when suppression takes place, the disease brings its inroads upon the internal organ. So, naturally, when suppression takes place, the disease will travel from a less important organ to the more important organ, or from the periphery to the center. And also on emote parts in which is unassociated in its primary disease. And also, it will affect the remote parts which is not associated with the primary disease. So the primary disease has no relationship with that part of the body, but still it has been affected because of suppression. When a gonorrheal discharge has been suppressed in the first or second stage, the patient will tell you that he has never been well since the day he was born. So when a person takes the modern medicine and he is suffering from the gonorrheal discharge, he will always tell you that he has not been well since he had been cured of the gonorrheal discharge. Why? Because those orthodox treatment had suppressed the gonorrheal discharge. Therefore, the patient will always tell you that I have never been well since I have been cured from my gonorrheal discharge. The patients may experience stomach trouble, gouty conditions, swelling of joints, heart troubles, kidney affections, etc. So, what will happen? The disease will go into the more important organs or into the remote parts of the organs or the remote locations, and the patient will experience stomach trouble, swelling of the joints, heart or kidney trouble, etc. Something is not right in the physical or the mental sphere. So something is not right, or there is a maladjustment or a misadjustment in the physical or the mental sphere. The abnormal sensation experienced by the patient before the onset shows that the miasmatic will unleash itself. So whatever abnormal sensation he is experiencing before the onset, it will show that the miasm is now ready to become active. Pathology in the initial stages will be absent. It will be pronounced in the later stages. And Dr. G.H. Allen has given many clinical cases. You can read it up from pages 54 to 58. So to conclude, no physician should be ignorant concerning the matter of suppression of the disease. So the physician should be knowledgeable and he should not suppress the disease, or he should know what are the consequences of suppression. He should know how to proceed to cure and also understand the difference between suppression and cure. So this is very important, that the physician should always treat a case so that it will lead to cure, and he should understand the difference between what is suppression and what is cure. Venereal diseases are not too difficult to cure if they are treated properly. J.H. Allen will again remind us that the venereal diseases are not difficult to cure if they are treated properly. That is what? There is no suppression. The peculiar expressions of the disturbed life force should be treated by the law of similarity. So naturally, whatever characteristic or the peculiar expressions are there because of the disturbance in the life force, it should be treated by no other means except by the law of similarity. All pathology due to suppression or loss of control of the disease in the initial stage. So pathology will be there because of the suppression, or the disease loses control because of suppression in the initial stages and the pathology develops. Hence, the secondary or the tertiary stage in psychosis or syphilis is the result of poor treatment. So whatever symptoms you're getting in the secondary or the tertiary stage in psychosis or syphilis, it is result of the poor treatment or suppressive treatment. So that's all in the short video. Hope you like this video. Please stay tuned for more. Part 5 will be coming up soon. Thank you very much.